one of our partners in planning this program, and that is Grace Call from the Council of State Governments. Grace, if you'd like to come on up and walk us through, you finally get to get on with some slides instead of just me talking at you. Here's Grace.
Well, good morning, everyone. I'm Grace Call from the Council of State Governments Justice Center. It's so nice to be with you all today. Our headquarters is in New York City, but I get to live and work in Iowa, Story County, Nevada, Iowa. So it's nice to be here with you all and talking with not only my colleagues, but also my neighbors and friends. So thank you all for being here today, and I'm really glad for the leadership of both Director Bartrup and Commissioner Ryan, and just appreciate not only the work of the folks at the Department of Corrections and the Department of Public Safety, but I also want to acknowledge Jenna Mole, who's here from the Justice Action Network to help facilitate some of the panels, and mostly thank Dr. Beth Skinner and Cord Overton for their tireless work on making this thing happen. So thank you all for being here today. Having talked to all of the folks that would be participating in the panel, I can't underscore what Cord said, which is 45 minutes is never enough to really address the topics that we're talking about today. But like Director Bartrup said this morning, this is a beginning, right? This is how we're starting the conversation, and I think really gonna start talking about some challenging things that Iowans are facing when it comes to public safety, when it comes to correctional services, and when it comes to helping victims of crime. So, super exciting, right? So a little bit about the Council of State Governments. We are a technical assistance resource for states, state governments, and folks that are working with all things that affect people in states, right? So we have an education arm, we have a health service arm, and I'm part of the criminal justice arm, or the Justice Center. In that, we have a couple of 3 primary programs. We have the National Reentry Resource Center. We have a program called Stepping Up, which I know many of you who are county officials here in Iowa are taking advantage of. And then we also have Justice Reinvestment, which is the team I'm on that does statewide data-driven policy approaches to reducing cost of incarceration and prison populations. Director Bartrup already talked about the summit that we hosted back in November. It was a fantastic event. I'm not saying Iowa was the best state there, but maybe it was the best state there. I'll go out on a limb and go ahead and say so. We had a great team. I think what was interesting is some of the particular challenges that every state's really facing. Some of the things aren't necessarily unique, but how you all address them, what it looks like, and the particular faces of folks that you're seeing does look unique in Iowa, as you'll hear when we talk to the panelists, right? So what we do know is that public safety strategies have to be well coordinated. And that's one of the things I think you'll see with the group that Cord put together of the panelists. You're gonna hear from mental health folks, public safety folks, victims folks, and all folks in between, right? We're gonna hear from elected officials and people that have a vested interest in the quality of lives for Iowans being better. Like never before, you're also going to hear about mental health and substance use challenges and needs of folks that are in our facilities and in our criminal justice system. I think this is probably something we hear about the most lately, but I think it also presents so many opportunities, and particularly in Iowa, you all have made great steps ahead. One of the other folks, one of the things that we're also going to talk about is how we kind of break the cycle of reopening. Sometimes we tend to focus a lot on our prison populations, but there's a lot to be gained by really focusing on people who are on supervision, people who are on probation, or sometimes first or early offenders. We're also going to talk a little bit about reducing the costs and thinking critically about how data drives the decisions that we make, and how we determine what things we want to focus on, what policies are important, or what ways the state of Iowa can save the most money and improve public safety the most. So it's kind of just an overview. I'm really excited to have folks here that are working day in and day out on these challenges and these needs of folks who are in your criminal justice system. I'm excited to get to that part. So I'm going to go ahead and thank everyone for your time, and really looking forward to the rest of the day. And with that, we're going to invite our panelists up for the public safety issues in rural Iowa, and I'll turn it over to Jenna.
Can you guys hear me okay? A little bit louder, is that better? public safety across the country. Every year we set up about 10 to 15 cities, and we've been very lucky to have partnered with Iowa for a couple of years now. I'm really excited about this particular panel because I grew up in a very small town, about 6,000. Still can't hear me? No? Is this better? Yeah. I'm sorry, I talk with my hands. It's a Finnish in me, so it's going to be a problem, but y'all will let me know, I'm sure. But so I grew up in a really small town in northern Wisconsin, and I always remember one of my favorite parts about growing up was just how tight-knit that community was. We already started talking about it here. And I remember when I first got my driver's license, if someone saw me speeding, they would just call my parents and say, Jenna was speeding down 5th Avenue today, you might want to let her know about that. Obviously, small towns across the country in Wisconsin and Iowa alike have changed quite a bit over the years. So we're going to talk a little bit about some of those issues, how those changes have affected public safety in those towns and in Iowa, and have, I think, a very good conversation. Okay, so the governor kind of talked about this a little bit at the beginning of the session, but Iowa is in a pretty good place when it comes to some of the crime trends that we're seeing. As you see, there's been ebbs and flows over the years in both violent and property crime, but historically, Iowa has remained below the national average. So it's not like you're facing this incredibly dire situation that is going to take just mountains to address. However, we are seeing some changes over the last few years. Nationally, we are seeing a slight increase in violent crime, and some of those increases are a little bit more prevalent in some of the smaller jurisdictions across the country. There's a lot of different theories about why that's the case. A lot of debates. I will say that I haven't heard one that I think really answers the entire question yet, but we'll be continuing to have that conversation, including with this panel today. And then right here in Iowa, we're also seeing some of those similar trends. We're seeing a bigger increase in some of these violent crime issues in some of our smaller areas, micropolitan areas, as well as non-metropolitan areas. Some of this is due to base rates. When you start with a very, very low violent crime rate, when you have even a small increase, it looks bigger when we look at the proportions. But that's an incredibly important issue to talk about. So our panelists today, we're very honored and thrilled to be here with Bob Lincoln of Black Hawk and Grundy County Social Services, Sheriff Dave McDaniel from Hardin County, Alan Ostergen, the Muscatine County Attorney, Lieutenant, I don't want to butcher your name, can you help me out there? Chupkes, Lieutenant Brent Chupkes from the Iowa State Patrol, Bruce Vandersanden, the Director of the 6th Judicial District Department of Correctional Services, and Representative Gary Worthen. Thank you all so much for being with us. So my first question for y'all is, what would you say is the #1 issue, the most significant issue facing rural areas of Iowa today in the fields of corrections and public safety? Hi.
Well, as a legislator and appropriator, this is not a field that I'm really involved in, so I had a sit down with my local sheriff yesterday afternoon. And I come from a community of 10,000, we're talking about trends, change in the trends in the crime rate and so on. And it's kind of an eye-opener, the prevalence of drugs in the occurrence of crime. My sheriff is talking about an arrest rate that in one way or another drugs are involved in over 50% of their arrests. And as we dug into it a little bit, we talked a little bit about the movement of drugs and what's happening there. And he believes that the pipeline, the pushers, the dealers are moving out of the metropolitan areas, moving into areas like ours because of a lighter density of law enforcement. And that's a huge concern. I mean, he talked about an arrest that was made this spring just across the county line from our community, that in a town of probably 900 or 1,000, they arrested a person that was pushing 2 pounds of meth a month. And that's what they're seeing. A lot of it is dealers aren't congregating in the metropolitan areas. They're moving out where law enforcement's a little less dense. And the users are moving with them. Number one, because that's where the supply is, and number two, because of lower housing costs and those types of things. So that's the trends that we're seeing in small town.
That's a two.
I kind of feel like I've come full circle because back in 1992, when I started in corrections, I was 12 years old. No. In 1992, I was a probation officer out in Tama County. So I know what it's like to work out in those areas. And back then, resources for treatment were very difficult to come by. And if you had a choice of one agency, that was considered pretty good back then. You know, then when I was in the Cedar Rapids area, where I'm director right now, you have 3 or 4 or 5 different places you can go to get treatment for individuals that need it. So resources have always been an issue. You're lucky to have one, and now it's getting to the point where if you have those resources, it's usually they're there once a week. So if you have a crisis, if it happens on Monday when they're in the office between 8 and 5, otherwise you might not have access to resources there. So that's one of the issues. I would also echo the drug issue. Having been in corrections so long, I remember forming a high-risk unit in our office and having a DE agent come out and talk to us about methamphetamine. And this DE agent had worked in the field for 30 years, and he said, I don't really have the answer for what we're going to do about the methamphetamine crisis. And here I sit 15 years later, and we talk about the opioid abuse and everything else that goes with it. In our halfway house the other night, we had our residential officers have to give Narcan to an individual twice in order to save his life. And then 24 hours later, we had another resident who was out looking for a job but decided not to look for a job. He decided to go out and use heroin. And local law enforcement got a call when he staggered in the streets, and they had to administer Narcan to him. So where we're at right now is a crisis with the drugs, and having appropriate resources to address the issues that we need to with the populations that we serve.
From a law enforcement standpoint, I'd echo what was already mentioned about them moving out of the metro areas and that. Where we're at, we're about half hour east of Fort Dodge, west of Waterloo, north of Marshalltown, Ames, south of Mason City. We're just kind of the hub of a handful of larger cities. And with us, on a good day, we'll have 3 deputies patrolling. On the best of days, on a normal day, it's 2, trying to cover about 575 square miles. So we've got an outstanding working relationship with our municipalities and with the state patrol. However, from a county standpoint, with our contract towns where they do not have local law enforcement, it's very enticing, which was mentioned, because we don't have a 24-hour law enforcement presence there. The cost of living is much less. If we pull a squad car into town, that little circle of drug users, drug pushers, within 5 minutes know we're in town. They know when we leave town. They will let their cohorts know, et cetera, et cetera. And then you throw on that to the mental health that we'll get into here probably in a bit. We're pulling guys off the street to do a transport. Our shortest transport is approximately 150 miles one way to find a bed. So we're doing anywhere from 300 to 400, 500 miles per transport, taking them off the street, leaving one guy patrolling 575 square miles. So the rural setting is much more enticing, just simply from a lack of presence from the law enforcement community, which I don't know what the solution to that is. Obviously, the citizens aren't in favor of their tax dollars getting jacked up to hire a bunch more deputies. And we do the best we can with what we have with the municipality, the local PDs helping us, state patrol helping us, but it's a trying task to say the least.
For the state patrol, we primarily are involved in traffic enforcement. We want to reduce crashes that result in injury and death. It's the leading cause of non-health related cause of death in Iowa, so obviously it's very important to us. And so in the last 10 years, there's been a great influx in traffic volume in Iowa. If anybody came across 80 today, they can see that there's areas where traffic's at a standstill, that it wasn't like that 10 years ago. When we have incidents on those types of roadways, it takes quite a response, and we can't be too far away to be able to clear that incident. We want to reduce secondary crashes, and we want to make sure that we return traffic back to normal so we don't have any more incidents. So what happens is our troopers have to stay close to those areas to be able to respond. So we're not in the rural areas as much as we used to. When I started with our department back in 1987, I was stationed in Guthrie Center and in Jefferson, and I was in small towns like Stewart and Casey and Scranton, Grand Junction, these little towns, and which many of them do not have police departments anymore. And it was standard practice every night that we're making our rounds and we're interacting with local law enforcement, and we're providing whatever resources that we can to those smaller communities. And there's a presence, it's a high visibility and enforcement presence that are in these small towns that isn't there like it used to be for whatever reasons. And so, in the last 10 years we've seen our numbers drop, and the influx in traffic and get pulled to these high volume roadways that we're not as much support as we would like to be and we need to be.
Thank you, Lieutenant. Going last, I want to be observant of Mark Twain's observation of bodies of speakers, that everything has been said, but not everybody has said it yet. But I just want to illustrate a point that the sheriff gave about his county, Hardin County, or would be true about my county, Muscatine County. We have this phrase, the thin blue line, that refers to how thin the veneer of law enforcement protection is between the public and criminals. So his county is 20% larger than the 5 boroughs of New York City. My county is about 10% larger, physically, land mass, than the 5 boroughs of New York City, our most populous city in America. And that vast landmass, patrolled by 1 person or 2 people, a few people working overnight, the diseconomy of scale of law enforcement in rural areas is going to be a common theme that you hear, along with mental health, along with drugs. That the sheriff, I think, was too nice to put it this way. If he has a mental health commitment, somebody's in crisis, somebody's gone to the court to get a family member committed, a very important function of the sheriff. That is a public safety emergency in Hardin County. Think about that. Going to the courthouse and getting somebody committed. I don't know if the sheriff would want to put it that way, but that's true. It is a public safety crisis because 50% of your manpower is out of service while that mental health commitment is undergoing. When we talk about drug enforcement, there's all kinds of things that we in law enforcement can do to proactively investigate and to address the drug threat. I was a drug prosecutor for a long time. I see some people here who've worked drug investigations. You can't buy drugs undercover with fewer than 6 officers. It's impossible to do, at least not responsibly or safely or in a way that will produce admissible evidence in court. Okay? Hardin County can't go out and buy drugs undercover. They need help from state, other agencies. We can do it in Muscatine because we have a dedicated drug task force, but it's very taxing. So that diseconomy of scale, I think, is going to be something that we're going to keep on hitting on.
Great, thank you. And if you wouldn't mind holding on to that mic, because I'm going to come to you first on this one.
Okay, make it a hard question.
I want to start with something that the director sort of briefly mentioned, and that's the availability of resources, especially in rural communities. Resources can be very scarce, and there's kind of 2 points in the system where we really want those, right? It's when you first interact with someone, when you first pick them up, when you first get arrested. If you see someone dealing with a mental health or a substance abuse issue, we'd love for there to be resources there. And then the other point is when you're getting deeper into the system, maybe they're on community supervision or probation or something, and there's something that could really help them get to success. So my question is a two-parter. What resources are available in your community right now? And in a perfect world, what would you have?
So I think the good news about what we have right now is it's better than it has been. I'll give you an example of mental health intervention. We are very fortunate that we have a hospital in our community that is part of a larger health system, and we have taken advantage of basically telepsych, okay? That you can do crisis intervention by bringing somebody to the emergency room, and you're not starting a commitment process, but you are giving the person access. They can talk to a psychiatrist who's actually physically in Rock Island, Illinois, and you can intervene way short of a full-blown mental health commitment. I think that's a really important thing. Before we started really systematically trying to divert mental health commitments, I think that last year we hit over 220 in mental health commitments in a community of 43,000 people. I shouldn't have said 220 because I don't know what the number is last year, but it's way, 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 way less. Way less. And when you think of just in terms of, I'm going to sort of sound heartless here for a minute. I'm going to set aside all the personal costs of a mental health commitment and just talk what it is to us in government. It's $3,000 to $5,000 every time we commit somebody, cost to the county. That is huge dollars going to very short-term, acute, often ineffective intervention for a period of a few days versus putting resources in to put somebody in front of a screen and talk to somebody who can maybe write a prescription. It's way, way cheaper to do that and way more effective. And let's go back to the human cost. A mental health commitment is sometimes necessary. It is not a panacea. And I think we are, thanks to some leadership of some people in this room, getting beyond simply the one-size-fits-all mental health commitment type approach to those kinds of crisis intervention things. In terms of law enforcement resources, we need more troopers, we need more state narcotics agents, we need more DCI agents, I need more deputies, I need more police, I need more prosecutors, I need more probation officers. I would never, I'll never be in the situation where I call Des Moines and say, I got too many troopers in my county, send them away, right? So I don't know how to answer the question, what would you get in a perfect world?
I think what we look at in rural Iowa, we happen to be in mental health areas that's kind of at the point of the spear as far as developing some new programs and so on. And they are helping out. They have a facility that where sheriff's department, whoever can take a person, but it's a volunteer type situation. It's not a commitment type situation. Those kinds of things help. The problems that we're looking at, my local sheriff is that they have had to sit with a patient in a local hospital for 3 days before they can find a mental health bed for them. We don't expect to have a mental health facility in Storm Lake, Iowa, but we do expect to have access to mental health facilities. And I guess there's a proposal that's come up here for a facility in Clive the last couple of weeks, one in eastern Iowa. Those types of things will help. But when my sheriff has to call in people and put them on overtime to sit with a patient 24/7 at a local hospital, and the local hospital doesn't want that person there. And of course those deputies don't want to sit there and basically do nothing for 8 hours at a time. But that's the situation we're in now. We can throw money at this situation, and like I said, the conversation I had with my sheriff yesterday is once these people get into this cycle of the drugs, you can send them to prison. They come back out, they get paroled back to the community that they came from, and they've got no place to go but back to the same people that they were running with before. And they're back in the circle again immediately. So I don't know that anybody has a solution for that, but prevention on the front side, and how do we determine what the best preventive methods are, and at what level do we start with those?
This seems like a good time to sneak this in. You heard earlier that Iowa, we are the best state in the country. And I believe that our DOC and our CBC system is also the best in the country, hands down. I've been all around the United States. I've met with other jurisdictions, other states, and they're envious of the system we have here. Now, with that said, we have 30,000 people that are on probation and parole, and I don't know what the count is today, 8,400 inmates. That's a lot of bodies, and I've heard over time by the former director and the current director that we end up being the biggest, largest provider of mental health services in the state, and that can't be. We built Anchor Center in Cedar Rapids, Iowa, to deal with co-occurring disorders for people that are under correctional control. Now think about that. Think about that. We had to build that to deal with people who had co-occurring disorders and they're in the correctional system. We often talk about when we hire people in corrections, you're going to wear two different hats. You're going to wear the hat of the enforcer, law enforcement. You're going to have the hat of an agent of change. But I think it's gone beyond that now. I think it's gone beyond that where we have to have the substance abuse provider hat, or we have to have the mental health evaluator and provider hats. We have agents now that are doing more with interventions, treatment programs than we've ever had before. And it's to no fault of the service providers across the state because they're working nonstop, but their resources are limited too. So what that system looks like, I don't know, but I would like to have more people be able to do that than just the correctional system itself.
Like you said, we lead the nation in a lot of things, but we're absolutely horrible in mental health in the state of Iowa, one of the worst in the nation. And how we address that, I don't necessarily know. Like the representative was saying, if we can get somebody in on a court committal and our deputy or the officer is out of that hospital within 12 to 24 hours, that's a good one. We're pleased if we're out of there in under 12 hours. Like he said, we've sat there for days on end paying overtime for somebody to do nothing but sit around the ER trying to locate a bed. When they do, it's 200 miles for us down to Davenport. Transport them down there, deadhead back, go down 2 days later for their hearing, pick them up, and bring them back yet again. And it's, I don't know what the answer is either. The bed availability is horrible. If we get to go to Blackhawk County, that's 45 minutes. I mean, our guys are like doing a happy dancer. So, it's like, great, I can still get back and be a deputy and do my job versus 6 hours round trip. And it's several times a week that we're making these runs. It's not once a month, anything like that. Resources we have available in Hardin County are pretty much non-existent. At no fault of anybody in particular. We are starting to dabble with a little bit of the telepsych at our hospital. And we are going to see some results of that in short order. And our region has developed a call-out team. I can't remember exactly what it is, but it's through the mental health. Yeah. And our guys are incredibly optimistic that that's going to help knock down our actual committals. So, but a solution, I don't have one without spending a lot of money.
Well, and for the solution, I'll turn to Mr. Lincoln.
That's not fair. That's not fair. Well, it's really encouraging to hear about the positive things that are happening and are more importantly are being recognized by law enforcement. I think the regions, after only a few years, have really made some investments and made some attempts. I think the most encouraging thing is when we focus on the crisis, which any crisis really is, a lack of resources or the level of resources when and where you need it, then how do we drive down from that crisis? We know the solution isn't more beds. We know it isn't more commitments. It is what's driving folks into the system and how do we increase the community capacity. And that's why I'm very excited about the legislation that was passed this year that really starts building an infrastructure for Iowa. Talks about 6 access centers. So you have a place to drive folks with needs, divert them from law enforcement. And that's the other issue I hear here too. Law enforcement can't be tied up with doing the work that we need to be doing. So how do we knock down those barriers between mental health services and law enforcement, so there's just a very, very fluid transfer. The investment we've made in people in corrections, in jails, I think we're doing a very good job of getting medication and mental health services to folks in jails, but what we still find is folks with chronic and persistent mental illness still get stuck there. And so the secret is going to be keeping people from getting into corrections to begin with. And that's why I think these access centers are very exciting. I think the other 2 pieces that are, I think, essential is getting a centralized crisis number for Iowa. There's a good national suicide crisis line, but Your Life Iowa now will be available to Iowa, and now from a data standpoint, we'll be able to measure how many calls are coming in each day, where are the calls coming from, what are they coming for, and then let's drive our resources back against that data. And then the assertive community treatment teams. For too long, we pulled people out of the community to get them substance abuse, to get them mental health treatment. We want to start driving the services in the community, and that's what's so exciting about assertive community treatment team. It's a hospital without walls. It's a psychiatrist that comes to your home, a nurse that comes to your home, a substance abuse counselor that comes to your home. And just having those folks in the community and accessible, I think will start building our capacity and reducing our pressure on law enforcement. I better stop.
Thank you very much. Sheriff, if you want to hang on, we'll start with you for the next one. You talked a little bit about some of the transportation issues that you're facing, transporting someone to a bed or to some sort of facility far outside of your jurisdiction. Can you give us a little bit more detail on that so we can better understand how that directly impacts your ability to protect public safety?
Well, one plus for us is we've got about 40 jail staff that if it's a simple transport, nonviolent type thing, occasionally we'll send a couple jail staff to do that transport to keep our deputies on the road. Sometimes, depending upon how far time of day, we're paying the overtime for somebody either to hang over, come out early to do the transport, but it's from a financial standpoint, we're paying a significant amount of money on these transports annually. It just kind of depends upon the situation, but we're always obviously having to pay somebody. We do our best not to take a deputy off the street if at all possible, but there's a lot of times it's just not feasible.
And has the demand increased in terms of like how often you're being called to facilitate these transports?
I would say it's increased. It certainly hasn't decreased. But it would vary anywhere from probably two to maybe 8 a week, just depending. And it can be at 1, 2 o'clock in the morning. It's something, it just kind of depends on what we're dealing with. There's times we've had to resort, which is incredibly disheartening, to acquire a booster seat because of the age of the child getting committed falls under the parameters that they have to still be in child restraint. And I've got a serious issue that somebody that has that need is at a mental state where they're even contemplating harming themselves. I can't wrap my head around that. And, so our staff as well, you're spending 3 hours in a car with a 6-year-old that just think about committing suicide. And, they're not trained, geared, or want to deal with that when they've got their 6-year-old at home in bed sleeping at 2 o'clock in the morning. So, I mean, you can look at it from the financial standpoint also, but from the mental and emotional standpoint that it's putting on our staff as well.
Absolutely, it's heartbreaking. Mr. Ostergren, do you see the same transportation issues in your county?
So we're fortunate, I mean, we're not as rural as Hardin County or a lot of places. Muscatine is the 14th largest by population county in the state. Frankly, we're doing a lot more with services in Illinois. Several years ago, the Iowa legislature changed the law to allow us to do a mental health commitment where the order was executed out of state. You may be familiar with the fact that the state of Illinois is less than functional, I think, in its government. And that legislation in Illinois to allow them to receive somebody in a mental health commitment took years to get passed because it was caught up in all kinds of fighting in that legislative process with the governor there. So we're way better than a lot of places. University of Iowa hospitals and clinics are just up the road, about a 40-minute drive. Terrific hospital in Davenport. So we're way better than a lot of places in the state in terms of those transport issues.
And just an open question, in case anyone has an answer, are there any kind of unique solutions to that issue of transportation that you've seen other counties doing, or maybe your own county, inter-county agreements or partnerships, partnering with some maybe nonprofits or privates? Are there any options out there for dealing with this?
Sort of indirectly on that, I think frankly we're doing a pretty good job in our county jail in that we have a sort of more intermediate trained, I think a licensed independent social worker level, like nurse practitioner, psychiatric provider in the jail, basically, I believe 32 hours a week. So that's a big deal for us. Now, that doesn't mean that we want to be treating people's mental health problems in jail, right? But we have a 255 bed jail in our county, which is pretty large because we house for other counties. But I think it's important as part of the big picture of how we deal with mental health crises in individuals that we have the services in jail. There's a lot of jails that don't have that ability. But again, that's an economy of scale issue, right? We have a jail that's way bigger than our population would support because we made a decision to have that facility to house federal inmates and for other counties. And so we can put a practitioner in the facility. We have full-time RN during the week and licensed practical nurses on the weekends, okay? So the inmates frankly have a lot more access to medical care than they would in a lot of other kind of correctional situations short of the prison system. So again, it's the diseconomy of scale, I think.
Lieutenant, I actually want to go to you with my next topic. I'm just kind of trying to hit some of these major points before we run out of time. One of the things that we've talked about is some of the smaller jurisdictions that are actually shuttering their local law enforcement and contracting with perhaps the sheriff to provide that. Can you talk about that a little bit, how prevalent that is, and how that might affect public safety in those areas?
Well, it goes back to, I'm not sure how prevalent it is. It has the appearances that it's quite prevalent. And I just think of the rural areas that I've been in the past, to where, and I alluded to it earlier, that there are many of these small town police departments that have closed. And so what we're trying to do, the State Patrol has initiated a pilot program where we're trying to maybe not use our data-driven enforcement to saturate a certain area and instead to make it some of these other communities into some hot spots that we have enforcement encounters, not just with our traffic enforcement or our arrests, but our community policing, where we're seen more and we interact more with communities, and so there's a police presence a little bit more in these communities to do what we can to assist those communities when we're not doing our traffic enforcement. And so we'll see what how this pilot is going to work out. We're hoping that that it's something that will reach our end goal, and that is not just reduce traffic, but also reduce some crime by increased presence. We know that that we do have to work smarter, that we can't have a shotgun approach to law enforcement and even what we do. And so we're looking at all kinds of ways that we can use some evidence-based, sustainable type programs. And so this is one way that we're gonna look at, and we're gonna do that. It may mean less enforcement contacts. It may mean less traffic citations or traffic contacts. But if in the end it has an increased presence and we can lower not just traffic but also crime by doing that, then we're going to deem that to be successful.
That's wonderful. And if you wouldn't mind passing that to the sheriff, I just want to get your take on the same issue. But while it's being handed down, I think that's just critical because, as we know, the number one way to deter crime is to increase the certainty of getting caught, right? And so I think the pilot is focused on not just traffic, but bodies in the streets. It's going to pay dividends.
I actually had 2 of our communities approach me in my first term about contracting law enforcement for them and looking at expanding their police department. My quote was high enough that deterred them pretty quickly, so my plan worked. But I was a municipal police officer for 20 years before running for sheriff. I don't know what the hell I was thinking, but I did. But with us doing it or the state patrol, you lose that personal connection with that community. Currently, we have 9 contract towns that we provide law enforcement for. If a deputy's in that community for 20 minutes to a half hour a day, that's a pretty good day that they're getting law enforcement presence. So if you take the local law enforcement away, I think you really lose employees or officers that are vested in that community. They're raising their kids there, their families go to church there, et cetera, et cetera. So they have a genuine care. Not that the deputies don't, but they just don't, we don't have the time or the manpower to give them the attention that a community necessarily needs, especially when if they currently have a department, they're probably big enough that they need to maintain a department. The crime rate, the drug problem certainly isn't going down by any stretch of the imagination. So to remove the police departments, I understand from a financial standpoint, but I think it's a major step backward in what we can provide to the communities by trying to task it onto the SO or the patrol type thing. We're not going to fill that void with the way we currently operate, plain and simple.
Representative Worth, I'm headed to you next. My question for you is, from your position as a legislator and someone who's deeply involved in the budget, what are the factors that you look at in terms of providing and maintaining public safety in rural communities? What are the different needs that you have to be balancing when you're looking at that?
Well, I try to look at a whole range of things. Of course, we only deal with the state agencies, the Highway Patrol, the DCI, DME. And so we look at those types of things, and I talk to my local sheriff's departments about what kind of support are they getting from these various agencies. And the thing that I struggle with, and with my colleagues in the legislature, is, we're all here today on a certain subject, on public safety. There's just a small portion of the legislature that maybe has that as their primary focus. And so, we can talk here today, but we're in an echo chamber. We're in a silo talking about public safety. And there's so much of what we're talking about today bleeds over into the Department of Human Services with juvenile people, with juvenile crime, with drugs, those kinds of treatments. It also bleeds over into the court system with juvenile court officers and the pressure that we're putting on them to handle all these cases. So, I walk a really fine line as chairman of Justice Systems, that number one, I've got to represent the taxpayer, but I also have to represent those departments that are under the purview of my committee, and be an advocate for them when it comes to the budgeting process. And so that's a struggle we go through every year. Those targets get set sometime during the session, and then we have to make things work within a target. And so, there's never enough money. There never will be enough money. We had a legislator several years ago that talking about the department that she was concerned with was, well, we should give them everything they ask for, and whatever's left over can go to the rest of the budget. So those are some of the things you're up against at times, and we struggle with those things. So, it's a difficult process. It's a long process. It's arduous. Can be very stressful. But we go through it and we do the best we can. If I could go back and comment a little bit on sheriff's taking over local policing, I think my local county has had a little different take on that, in that every one of those contracts, or maybe 2 contracts with the city, they've added a deputy. And the city has ponied up a pretty good share of the cost of that deputy. So then you've got law enforcement that is better interconnected in the county, and is also better connected with the state agencies, with intelligence and those types of things. And they're seeing some advantages to that. So, you know, there's 2 sides of the coin there. I guess it can cut both ways. I think the one story that kind of, we talked about yesterday, small community in Buena Vista County, they had a kidnapping that was related to 2 pounds of marijuana. So the county's got 6 or 7 deputies in town. DCI's got an agent in town. I don't know if B&E was there or not. But the sheriff calls the mayor and says, here's what's going on in town. You know, we've got all these deputies. There was 2 pounds of marijuana. There was a kidnapping. A person brought from Fort Dodge was kidnapped from Fort Dodge and brought here. And after this conversation, the mayor goes, "Yeah, but what about that junk car up on Grape Street?" You know, so that's the dilemma that they're in also. So
That's a great perspective. Thank you. Mr. Lincoln, my last question is going to be for you. We've spent a lot of time talking about mental health on this panel, and there's actually going to be another panel specifically on mental health. But one of the things you mentioned earlier is how critical it is to intervene early before someone ever makes justice system contact. Beyond mental health crises, what are some of the other drivers that you're seeing of that justice system contact that we should be thinking about and paying attention to?
Thank you. Well, you made me think of the mental health first aid class I taught last week in Guttenberg. I had 3 local police officers there, and through the course of that day with other agencies there, we had a very substantive conversation on how best to use law enforcement, and had a police chief that was very aware of the impact that mental health has on his jobs and the jobs of his officers. So that was very exciting, and making those relationships. It's all about those relationships and breaking those boundaries. The other opportunity we've had is with Chief Brinkley with the Mason City Police Force. He's welcomed one of our social workers onto his team. We give him a half-time social worker. We've had a lot of experience working with sheriffs and the jails. Now working with the police gets us even more ahead of some of the interventions, and so we're seeing some real resource challenges there, but again, it's really helping us identify opportunities to intervene earlier.
That's great, thank you. I'm not sure what court is. I think we actually have time for one question. Do we have time for one question? Okay, perfect, just one. Any questions from the audience? I have been very selfish with these experts' time, so if anyone would like to jump in.
Hi, my name is Carrie. I had a question for the panel. There's been a lot of talk about arrests and resources around police officers, but what are rural communities that you all represent doing to do true primary crime prevention? We know there's risk and protective factors for whether or not someone actually is going to engage in behavior that violates the law. So thinking about under-resourcing, what's being done to actually look at not just preventing recidivism, but primary prevention in your communities?
From a sheriff's office standpoint, in our county, the sheriff's office teaches DARE in every school district that we have. At least making some contact with the students. I know there's various opinions on the success of DARE or whatnot, but at least they're establishing a rapport with law enforcement. We take every opportunity we can to get involved with town celebrations. We host what they call a family fest, which is kind of an educational anti-drug, anti-crime. Usually have like McGruff there, and just various things where we put our staff out there as much as we possibly can in a proactive way of dealing with the youth and even on up through the adults. To speak to different civic organizations, anything that we can do to try to head things off, we take those opportunities. We get our deputies into schools. We try to get them in at least one school a day, just making a walkthrough, seeing the kids, just like I said, establishing that rapport so they're more comfortable with us. And if they do something wrong, there's that disappointment in that they feel like they personally let that deputy down or whatever it may be. So whether it's working or not, I honestly couldn't tell you, but we're making the efforts that we can with the resources we have available.
All right, well, I think that about wraps it up. Thank you so much for that answer, and please join me in thanking this extraordinary group.
To our panelists. That was very enlightening. Real quickly, there's a white Toyota Camry, Davis County plates. Your passenger side window's down. You might want to go roll that up. It is raining out. Remember to sign up for lunch and tours over there on your way out during the 15-minute break. We will start again at 10:30. Thank you.